Are you thinking about moving abroad, but you're worried about getting sick or finding a doctor you can trust? You're not alone. For many Americans, the thought of navigating healthcare in a new country is their number one fear. But here's the truth. Healthcare abroad, especially in places like Mexico, can be high quality, affordable, and even life-changing. In this video, I'll walk you through exactly how to find doctors, get insurance, and buy the medications you need while living abroad. Let's break it down step by step. One of the biggest fears people have when considering a move abroad, especially as single parents over 40, is healthcare. What if you get sick? What if your child or grandchild visits you and something happens? What if you have a chronic health condition that needs regular medication? These are valid questions. But today, I want to show you that not only is healthcare abroad manageable, it can often be better and more affordable than what you're used to in the United States. So let's start with one of the most popular destinations for expats and retirees, Mexico, my new home. Mexico has a two-tier healthcare system, public and private. The public system includes institutions like IMSS, which stands for Instituto Mexicano del Seguro Social, and INSABI, INSABI, which stands for Instituto de Salud para el Bienestar. These are funded by the government and offer basic health care, sometimes even free, especially for citizens and legal residents. First thing I want to show you in this video are the pharmacies. This one is a popular one, Farmacias Similares. This means the same but for cheaper. And if you've got a minor problem like a skin rash, bug bite, insect bite, stomach ache, stomach virus, those kind of normal run-of-the-mill type of things, you can come here first. You can get a doctor's consult for like 60 or 70 pesos. That's just a few dollars. And then after you get that done, you can go in and get medications for quite inexpensively. I purchase medications about $10 or $15, and that's it. No health insurance required. So I definitely recommend this pharmacy. There's a view of that same pharmacy from the other side here. You just go in there, there's a doctor, and you go in there and you tell them in Spanish what your problem is, and they will help you out. Very economical, very great place to get started. If you have, like I said, a minor health problem, if you have a medical emergency, you call 911. Next pharmacy I want to show you is a really popular one, Farmacia Guadalajara. And they're not just in Guadalajara. You can find these in Puerto Vallarta, Mazatlan, etc. And some of these are open 24/7, which is great. Again, if you have a minor health problem, come right here. You wake up in the middle of the night with a stomach virus, come here. See a doctor for quite inexpensively, as I've said. And they got plenty of medications here. Another great thing about Mexico is you can get the medication you need for far less. And there's a lot greater variety available. It's Farmacia Guadalajara. The private system offers faster access, newer facilities, English-speaking doctors, and often shorter wait times. And compared to U.S. standards, the cost is a fraction of what you're used to paying. If you're just visiting Mexico, you won't be eligible for public care. But if you're living there long-term and get residency, you can enroll in IMSS for a low annual fee. More on that in a bit. Let's talk about IMSS first. If you work in Mexico for a company, your employer usually enrolls you automatically. But if you're self-employed or you're retired, you can also apply voluntarily. The cost is around $500 to $700 US per year. Coverage includes doctor's visits, surgeries, hospital stays, maternity care, and prescriptions. The limitations are long wait times, fewer doctors and providers that speak English, and some medications or procedures may not be available. INSABI, INSABI, is a newer program focused on free healthcare for the uninsured, but it's mainly aimed at Mexican nationals and lower-income residents. Most expats choose private care instead, or combine both public and private options to get the best of both worlds. Healthcare in Mexico is world-class in many cities, especially in Guadalajara, Mexico City, Puerto Vallarta, and Mérida. You'll find English-speaking doctors, modern equipment, fast appointments, affordable out-of-pocket costs, and more. For example, a general doctor's visit might cost $25 to $50. A specialist visit might be $40 to $100 US. In my case, I went to a gastroenterologist recently at a private hospital in Zapopan, which is a northwestern suburb of Guadalajara, and I was seen for 1,900 pesos approximately, which is almost $100. No other out-of-pocket costs, just that one fee, no medical insurance required. Many doctors will chat with you via WhatsApp before and after your appointment. In my case, my appointment was about an hour, was completely unrushed. It was almost a social experience. Even dental care and cosmetic surgery are popular here. And not just because of cost, but because of quality. You get more for your dollar here, or peso. You're wondering, how do I even find a good doctor here? There are 4 ways to find reliable care. First one is Google reviews and Google Maps. You can search in English or Spanish. Look for ratings above 4.5 stars. There are Facebook expat groups. For example, My Medical Concierge. If you live in Guadalajara, My Medical Concierge is run by a woman named Lori, and she could help you save a lot of time. She'll do a lot of the legwork for you and find a good provider for you. Other Facebook expat groups, you just ask locals what they do, who they recommend in your city. Hospital directories. Private hospitals often list their affiliated doctors online. Local clinics, like earlier in this video, go to pharmacies, Farmacia Guadalajara, Farmacias Similares, Farmacias Benavides, and so on. These offer low-cost consultations, usually 50 pesos, or maybe a little bit more, 60 or 70 pesos. It's usually less than $5 US. Now let's talk about health insurance. Here you've got 3 main options. First one is paying out of pocket. Yes, that's that affordable. In my case, I use the public healthcare system, like the pharmacies I mentioned. There's also La Cruz Roja Mexicana. A year ago, I checked them out. I was recommended to go there by a group of nurses at a coffee shop. The problem I thought was Montezuma's revenge. It turned out it was a fungal infection that started out in one of my toes on my right foot and it spread upward on my leg. Cruz Roja, you pay in cash and the prices are very transparent. A lot of people skip insurance and just pay as they need, pay as you go. There's local Mexican insurance. You have providers like GNP, AXA, or MetLife. They offer plans from $40 to $100 per month. You also have international expat insurance like I do. Companies like IMG, Cigna Global, and Safety Wing are popular if you want worldwide coverage or if you plan to travel a lot. Personally, I recommend having a basic plan for emergencies, even if you pay mostly out of pocket. In Mexico, many medications that require a prescription in the United States are often available over the counter. These include antibiotics, birth control, blood pressure medications, and some antidepressants and anti-anxiety medications. However, certain controlled substances like strong painkillers or ADHD meds, those are tightly restricted or even unavailable here in Mexico. My tip is bring a 90-day supply of any essential prescriptions when you arrive, and consult a local doctor to find out what's available in Mexico, or the local equivalent. Before you move abroad, here is your healthcare checklist. Bring the full printed medical history, translated into Spanish if possible. Have all your medications listed in a table in Microsoft Word or Microsoft Excel spreadsheet if you prefer. Pack at least 3 months worth of essential medications. Get international insurance for your first few months. Research hospitals and clinics near your new city. And learn a few medical terms in Spanish. It helps. I know healthcare can be one of the scariest parts of moving abroad, but you don't have to face it alone. You can absolutely find great care, trustworthy doctors, and affordable medication, especially here in Mexico. In fact, many expats say they're healthier and less stressed after moving abroad, because they're finally getting the care they need without going into debt. If you found this video helpful, give it a like, share it with a friend, and don't forget to hit the subscribe button so you don't miss any new videos. And don't forget to grab my 2 free PDFs in the description below. One helps you get your first passport, the other one helps you pick your perfect country. In this PDF, I have 20 countries that list English as an official language. This is the Spend channel, single parent, empty nester, digital nomad, where we help single parents over 40 in the U.S. learn how to live abroad, explore, thrive, and finally put themselves first. See you in the next video. Thank you for watching. Take care. We'll see you next time.